Hello, everyone, and welcome to the Mind Games podcast, where each episode we piece together the puzzle that is mental health with a bit of stuff in between. So this is real talk from two very real people. I am Thomas Welburn, chronic health warrior, multimedia extraordinaire. Joining me on this inner path of discovery is my co-presenter, the master of positivity, the Starsky to my hutch, Chris Allen, occupational health advisor, mental health first aid instructor, and all-round great guy. How's it going, Chris?
Yes, it's going very well. Thank you, Tom. How's things in your world?
My world's interesting. I've hit a milestone in my life recently, as in I am 30. So
congratulations.
It's the master of positivity. You know, it's uphill from here. It's not downhill.
Yes, of course. Yeah, absolutely. I completely agree. So congratulations on reaching it.
Yeah, no. And I've just, had a massive 2-week break where I've been kind of all around the Yorkshire coast and Bath and just having a bit of time out. And it was quite nice. Me and my girlfriend have been quite busy, just chilling out. So that was how I spent my 30th. And I'm quite a personal guy with that stuff. So I didn't want the whole big party kind of stuff that some people want with their 30th. That's just me.
Yeah. Good. And I think that's one of the advantages when you get to 30, you kind of know who you are and what you're about. You have those insights, don't you?
Yeah, absolutely. I guess we'll just crack into the episode. Yeah. So we've got 3 sections, like we always say. We have the discussion, the Q&A, and the in clinic. We've got some interesting, juicy stuff for each section. And for the discussion part, we're going to jump into that in a second. And we've got a really interesting thing on kind of maternal mental health during the COVID-19 pandemic. And I guess how the pandemic has affected that whole maternal aspect of women. And Chris is going to go into that and talk about the article that we got this from. Quite interesting, from Women's Health. So we'll see you on there in a minute.
Discussion.
Welcome back, everyone. We're at the discussion part. And as I said, just before we jumped over here, we've got a really interesting bit on maternal mental health during the COVID-19 pandemic, which was a Women's Health article. And I'm going to just hand over to Chris, who sent this to me, and we had a little back and forth about it. It's quite interesting.
Yeah, so I think this is a relevant topic for discussion for quite a few reasons. It was actually sent to me by my wife, who we were having a conversation about it. But when I read through the article you'll be able to find it by Googling Maternal Health Crisis, Women's Health, and you'll find the article. It's a very, very insightful article. It talks about facts and figures, of course it does, but it also talks about lived experience. So it's got a nice balance. But what I would say, the thing that struck me most was the fact that almost half of new mums have got clinically relevant depression. And more than half, so we're looking towards 60% or over 60%, I think it was 61 or 62, for anxiety. Now, your first question, Tom, might be, what is clinically relevant depression? And what I would say is it would meet the criteria for mild, moderate, or severe depression if it's clinically relevant. Does that make sense?
Yeah.
So some of the things that have been driving this problem are, and we were having a real good conversation about it, because although I inquired about shared parental leave, at the time when we had babies, it was a brand new thing. It's much more common now, but it was brand new. And I remember talking to my organization about it, and I got passed from pillar to post. It was within a few months of it coming out, of it being a thing, shared parental leave. So I didn't get the opportunity to use it because no one knew how it would possibly work, because it was so new. No one had done it before, but I have met men who've done it. But anyway, that's a little preface as to me about to launch into my wife taking the whole of her maternity leave off. So it wasn't shared, although it would have been nice to, I think, to have shared it. My wife stayed home with the baby.
Was that a choice? Was that her choice?
Oh, yeah. I think it was her choice. We explored shared parental leave, but in the end, we decided together not to push it to make it happen. we went, we did some fact finding, and it turns out facts were not found because it was so brand new and it just wasn't an option for us. I took my own parental leave that I was entitled to, which was in the region of about 2 weeks, and then another 2-week holiday annual leave after that. So I got a good month with the babies. And then, of course, I'm a very involved dad. So, we have bonded. But what I will say is that when we had babies, it was outside of the pandemic. And there was lots of community engagement things going on. So my wife met lots of people who are still our friends now. Baby and mum groups have been a real lifeline for new mums over the years. And we were living in an area of London. It was very well provided for back then. It was near Canary Wharf, in Poplar, Limehouse area. There was lots going on around there for new mums. And I think one of the reasons that we've seen this dip that the article was talking about is because of the lack of these sort of community groups. I would hazard to say that it's a part of lockdown has had an impact on new mums and their biopsychosocial well-being. So their body's changed. The equilibrium of their body changes hugely throughout pregnancy. So that's the bio side. The psycho side is it's an incredible psychological shift from being like a woman to now being a mother. And you can be both of those things at the same time, but we have to acknowledge that it is a change. And then you've got the social side, whereby not only are you locked down and distant from your friends, but you also can't share your experiences with the other new mums that you ordinarily would do if you were going to these sort of baby and mum groups and classes and things like this. So all of the pandemic management measures somewhat are compounded for new mums. So when we're talking about new mums, I'm thinking about pregnancy, but we're also thinking about postnatal as well. And so if we know anything about mental health, it's that, lack of social contact, the biological changes that happen, and the psychological shifts are going to increase the risks. Would you agree?
Yeah, and I think you mentioned postnatal. There's big conditions that some mums can get after childbirth, like postnatal depression and things like that really need support and care. And I suppose if those services have been impacted by the pandemic, that is really, really bad and concerning, because for something, I know some people that have had postnatal depression and things like that, and it can be really bad. It can really affect the woman's life, and it can be a downward spiral that's really hard to snap out of by yourself. And then there's other conditions as well, and I'm trying to remember the name of it, where there's a myriad of conditions that you can get after childbirth that affect your mental well-being. And
some additional drivers for a lot of these problems include things like uncertainties around sort of healthcare provision. So whether you're going to be able to have your baby in a hospital or whether you're going to have to change some of your birth plan as a result of the pandemic. Now, in both circumstances, the birth plan went right out of the window as the baby was coming from my wife and I, when circumstances dictate differently. But you can imagine how a lot of the procedures and a lot of these sort of hospital appointments have been deferred or put off for a lot of people all over the country. But you can't really defer or put off the baby. It's coming, whether you like it or not. So, we've heard a lot about waiting lists growing longer and longer, and the changes in the NHS as a result of the pandemic while they've had to redouble their efforts in a different sort of place for the time being. But that doesn't mean that baby's going to wait around, until the pandemic's over. So there's a lot of these sort of things that are driving the anxieties as well. So that's sort of more of the prenatal point of view and the lead up to the birth that have been stoking anxieties and contributing to the decline in mental health, in maternal mental health for women. I was shocked, actually, to read in that article as well that suicide is the highest cause of death in perinatal women. Now, perinatal women are anyone who anyone who experiences perinatal is termed, let me redo that. I was surprised as well to learn that suicide is the highest cause of death in perinatal women. Now, sort of perinatal mental health problems, we have to think about it from the point of view as it's what's occurring during pregnancy or in the first year following the birth of a child. And I was very surprised to read about the higher rate of suicide for these women who are living through this. Some of the other issues that have fueled this sort of rise, this crisis, if you like, relate to the postcode lottery. Now, if anyone who's listening doesn't know what the term postcode lottery means, it means whether you have access to services depending on where geographically you live. So someone who lives, for example, just pulling a place out of the air in Kent might have access to a different level of service than someone who, pulling another place out of the air, someone who lives in London. All right. Now, when it comes to perinatal or, postnatal, natal mental health services, it is a postcode lottery. And so when these specialist services are lacking or do not exist in a geographical location, then women need to engage with the sort of what's called mainstream services. So the same services that everybody else is. We all have heard throughout the whole pandemic about the challenges that there have been as a result of the sort of the need to cut back and the need to change the way the health service operates at a very, very short notice, very, very off the cuff sort of period with the pandemic and everything that's been going on. So they're already stretched and it cannot really be relied upon for women who are experiencing perinatal mental health problems. Furthermore, additional drivers, which I've always found very interesting, is the concept of when people don't necessarily qualify for support because they're not unwell enough. And of course, what's going to happen is if you leave a problem, it's only going to compound with time. What I've always found interesting is with regard to things like the classification of mild to moderate depression, anxiety, or any sort of mental health condition, and how that may not classify you or entitle you to get some support or some help. You cannot get help in many services until it's severe. But of course, what happens to a problem, if you leave it too long, it's going to compound and become severe. So enabling access and support for mild to moderate mental health problems as it relates to, postnatal depression and this sort of mental health crisis that we're discussing, the anxiety issue as well, would hopefully provide some additional level of support. And while it may not necessarily be curative, it would definitely be supportive.
And I think just to add to that from what you said, when you let something like that compound and get worse, it's often more difficult to fix in the future. So if you're talking about a resource point of view, it's gonna actually in the long term end up using more healthcare resources to fix the problem than it would if you caught it early and got on top of it quickly. I don't know if I'm sure you would agree with that.
Yeah, I would definitely agree with treating early or accessing help early. So what is the help that people can do, I guess, is the next question, right? How can people receive the help that they need at the moment?
Well, that's the difficult question because I think for a lot of people it's quite hard.
Yeah, I suppose so. I mean, the first port of call would need to be the GP. It needs to be the GP, really. People and the midwife. So having these sort of conversations with the midwife or the health visitor or the GP hopefully will enable access to some sort of support. And of course, again, if the person happens to be employed and there's an EAP service or employee advisory program or some sort of counseling help or support that can be accessed, then that's another avenue for help and support as well. But when it comes to the self-help side of things, I always like to discuss, we need to think about how, first of all, acknowledge and accept and normalize. So accept that the ill health is there. And it can happen to anybody and it isn't your fault. So postnatal depression, it happens. We know this. We need to accept that it does. It doesn't mean that you're deficient or it doesn't mean that you're a bad mother or a bad parent. You've gone through a huge change in your life. all right, with everything that we've been discussing, the bio, the psycho, the social changes. So do have a conversation with the health visitor, please, the GP, the midwife. Try and foster some social connections if it's possible. Search for any sort of local organizations or new mum groups that might be there and see if there's a chance to connect. Given the current circumstances, it might be on video, but it's better than nothing. Would you agree?
Yeah. But I think we also have to recognize the difficulty in accessing care at the moment because of the pandemic. And it might not be as simple as getting access to a GP or a midwife, because it is quite hard accessing those frontline services at the moment with everything that's going on. And a lot of them are not running a full service like they typically would. And you often have to go through some sort of electronic consultation system because the practices are closed. So I think we have to acknowledge that although that is the recommended care path, it's probably, in reality, it might not be that simple at the moment.
Yeah, I completely agree. And that's why I would say that the self-care side of things is important as well. So that self-care advice about support groups, social connections, all of those things are driven home as well.
Yeah, absolutely. Self-care is great. And I learned that from someone in particular.
Thank you.
So, I don't know. Is there anything more to say on that topic, or do you think?
I don't think.
I think we concluded it well on the basis of, there are certain things that you should be doing. It's just unfortunate the situation that we're in makes it quite hard to access those services. But I don't think there's no conclusive answer again, is there? Because it's the nature of the pandemic. But we would hope once the pandemic is over, that it is easier to access those services again.
Yes.
So on that note, we're going to now move into the Q&A section, and the question that we've got this week is quite an interesting one. I don't really know what more to say that other than just meet us on the Q&A and we'll talk about it.
Q&A.
So welcome back. We're now in the Q&A section, and as I said before the break, this is quite a question. A little bit depressing, but I think also very relevant too, because I'm sure a lot of people have thought this and have probably experienced it. So Chris is going to read it out.
Yes, I am. Chris, the question comes through. Chris, people are rubbish. I have to deal with difficult people every day. How do we protect our mental health from people who are mean, selfish, vindictive, and generally unpleasant? And that comes from ML. So thank you, ML.
I'm going to say one thing before you kick off, which is the first thing I thought when I heard this question was that the whole phrasing of it has a very negative outlook of the world and life. So one quick thing that I would say is you probably need to, first of all, think about your reflection of the world and maybe try and rein that in a bit, because I know there's a lot of things about the world that are really annoying and not nice, but we have to try as best we can to keep positive and have a positive outlook.
I completely agree. And what I would say is that the things that follow that I'm intending to discuss with regard to this question, they are a lot to do with perspective. So Tom's point about, you really got to try and not see the world that way. Well, here's how, I think. But interesting opening gambit, isn't it? Very interesting. Chris, people are rubbish. Very interesting opening gambit. But let's proceed. To a certain extent, I believe what ML is saying could well be true.
Probably is true.
Could well be true. People are motivated by all sorts of ridiculous and silly and, things that make them lie and act out and just be generally difficult. So if people are rubbish, it doesn't mean that all are, and it doesn't mean that we need to be, does it? So I think I will start really to answer this question by saying that people are my occupation. Actually, when I was reflecting on this question yesterday when it came through, I was thinking to myself that, my occupation is people. But I was reflecting further, and I talk to you on a regular basis, and you're always in meetings with people. You're always getting emails from people, and if you are in or out of everyday life, generally you are engaging with people. So it is your business. I would begin this question by saying it is your business, ML, to deal with people.
And it's also unhealthy if you don't deal with people.
Yeah, true. So my overarching advice, just to reinforce what Tom was saying earlier on, I guess, is to be patient with people. That's my main thing. Be patient with people. But how? And I've got a few things to discuss. I've got a few things that I was thinking about in order to discuss this. And a lot of it comes from all the books that I read all the time about how to do well in life with people. So, the first one is that one of my main principal core concerns, it did take me mid-20s to mid-30s to really begin to embody, but external validation. If you seek external validation, I consider that to be a recipe for disappointment, because validation has to come from within.
I love that. I love that. I love that. That is spot on.
There's an ancient Roman emperor who used to give out advice, and we can still read that book now. It's by Marcus Aurelius, and the book is Meditations. But one of the things that he said in the book, it's not entirely relevant to the modern world. There's stuff in there about, being kind to your slaves, which you can just sort of, not entertain. But there is some wisdom in there still. And one of the things that I really like that he said in that book was, we love ourselves more than we love other people, but we care about other people's opinions more than our own. Other people's opinions don't matter, and it's a little bit sort of rude to try and get inside someone else's head. And this idea of comparing or seeking external validation, you can never accumulate enough things. There will always be someone with more than you, whatever it is, whether it's, holidays, whether it's life experience, whether it's money, whether it's cars, whatever it is, there will always be someone with more. And so that external validation is not going to be able to, serve you. Go on.
Well, I was going to say, I think that external validation point as well in this day and age has never been truer, especially with the advent of that word, that two word, which we always talk about, which is social media. Because social media is just pretty much orientated around external validation now, isn't it?
Yeah, I think it is. You measure yourself on social media, or your account is measured by the social media companies. And therefore your exposure on social media is measured by how many followers you have.
Yeah, like the way it works, the business model is based around how much external validation your profile is getting. If you think about it, which is, it's not a particularly healthy thing to think about when you kind of realize that that's what it's all based around. And obviously that's what social media has become. It's all about projection, and projecting your views on everyone else to seek that validation almost. And it's not a good thing. I don't know if this person spends a lot of time on social media, which is kind of maybe skewed their view a bit, but I think if you are using social media, take some time away from it, because that's what I tend to do these days. And I think it does give you a better reflection of the actual world at large.
Yeah. So, to sum up that part of the first part, really, of what I wanted to say in regard to this question was, measure yourself against your own principles. You know what's right. You know what's right for you. Stick to those principles. Measure yourself against those.
Yeah.
The next one really is about dealing with difficult people. The next, thought I had with regard to this was about taking things personally. it's really easy when you get cut off in traffic or when someone's just plain rude to take it personally, to see yourself at the center of this turmoil or, whatever it is that's going on. But, if we engage in filling in other people's fictions, that will make our experience ugly. So when things don't go your way, when someone hurts you or something is, not going according to your plan or someone screws you over, et cetera, you can always ask yourself, like, when have I engaged in those things? And we begin to, I think, normalize it. We begin to sort of be a bit more relatable rather than labeling someone a good or a bad person, a terrible person, a difficult person. When have I cut someone off in traffic and why did I do it? Was I in a rush? Was I trying to get to an appointment?
Yeah, and again, it's something I agree with and I try to do, because you could let loose at somebody for something that has got you the wrong way that day, but they have a life. You don't know what they're going through, what caused that whole thing.
Exactly.
They could be having just as bad of a day as you, if not worse. And you should always try to think of that scenario of, well, what are they actually going through? I mean, that's what I try to do. And I try to not really be nasty to anyone if I can help it.
So don't blame. Because you might have made a similar mistake before and you were probably doing your best to not make a mistake. Whatever it was, that's what I would say. Try and not take things personally and try and be relatable. Try and relate back to the individual as well. The next thing that I was considering when it comes to answering this question about dealing with difficult people is with regard to comparisons. Now, you may compare yourself, and this ties a little bit back to the social media side of things as well. But I think it was Theodore Roosevelt that said that comparisons are the thief of joy. And I really like that. But that ties in again, doesn't it, with when we see the figment of someone else's imagination of what their life could be like on social media. The perhaps instinctual thing might be comparison. So when we compare ourselves to others, you've got to remember that what I like to do anyway is try and pull myself out of that and compare myself to myself from 5 years ago. And then consider whether I would be envious of me right now. Rather than comparing myself to other people, it's silly. I know it's really silly to do something like that, but
that's a really good idea if you've come a long way. If you've come a long way in those 5 years, that's a good idea. But I think for someone who maybe is still stuck in the rut of whatever they're going through in life and they haven't really moved on, I think it's hard to reflect back when you haven't moved forward. I don't know what you would say to that as a solution, but it's just something that I would know.
Yeah, I'm not sure there is a solution to that, but as you know, and as you've lived it, maybe that one doesn't work for you. Maybe some of the other points that were for discussion there might seem more relevant to someone with a lived experience like yours.
Yeah, I'm trying to think of a good answer to that one. If you haven't,
doesn't need one.
Yeah, I mean, does it need one?
Does it need one? I mean, this is just my point of view, isn't it? This is a question that I've got from ML, and we're just attempting to answer it. Can't necessarily say that this recipe of advice is necessarily going to be the thing that hits the nail on the head for ML, but hopefully, I've put out a few points of view that might maybe be more helpful than unhelpful. I don't know. I mean, that one might well be unhelpful, and that's fine. It's balanced.
I think perhaps what I would say, because you were saying, look past to the past 5 years and how far you've come. Say you haven't. Well, you don't personally think you've come that far. Then my advice to that would be, well, start working out how you're going to improve.
Well, yeah.
Yeah. And then maybe in 5 years' time, you will look back and you'll see that as the moment that made me change.
And ML, I hope you are listening to this, but actually what Tom just said will be echoed in the next section in clinic. So stay tuned, because I have some more to say about what Tom just said there. The last bit I want to say with regard to your question is to just say to yourself, thank goodness for the good souls. Now, thank goodness for the good souls. I don't know why that line came to me, but it is a line from like a 2001 indie band called Star Sailor. And they were going to be massive. They were primed.
I've never heard of these at all.
Yeah, they were going to be huge back in the day. But then the Strokes happened with their tight leather jackets, their riffs, and their Converse trainers. The tsunami of the Strokes came and just blew everything away in its wake.
Wow.
So they never made it to where they are, where they were feted to be. But thank goodness for the good souls is really like cherish the good people around you. Thank that you've got those people, because they may not always be there. And so spend that time, get that advice, really make good connections with people, and have those good times with the people that you cherish. Thank goodness for the good souls. Yeah. Star Sailor came to my mind when I was reading your question. I'm sorry.
I'm literally going to go and listen to that song now, because I'm curious as to what the lyrics are. I've never even heard of Star Sailors.
No, you wouldn't have. You're 10 years too.
I know the Strokes.
Late,
I mean, everyone
Sailor.
was listening to the Strokes.
Well, exactly. But Star Sailor were going to be huge at one point, and then the Strokes came along, and the Libertines came along.
Okay, well, ML. I hope we've answered your question, and I hope this helps. And please do get in touch if you want to send us another, or if you just want to let us know, how you've gotten on. Maybe try and turn that perspective of the world around, because it's got bad things about it, definitely, but having been in that mindset myself several years ago, it's just not healthy, and you need to try and see the good in as many things as you can, and obviously acknowledge that there's a lot of bad things that happen, because that's naive if you just think that everything's perfect. But I think I would just say you've got to try and be positive, because it's just, otherwise it's just nowhere to live. You will get depressed. And I think on that note, we're going to go into the final part now, which is the in clinic, where, as Chris said, it kind of follows on from this, I think. So we're going to shoot into that in a second, and we'll see you on the other side.
In clinic.
Hello, everyone. Welcome back to the in clinic section. Obviously, this is the bit where Chris takes more of a leading role, and where we go into a specific topic, but a lot more deeper. So this is something that we kind of spoke about a little bit, and then thought it'd be a good thing to talk about, just mainly because it ties in with the Q&A section that we literally just finished. And I suppose it's about what do you do if you kind of fall out of love with your passion? Is it, Chris? Yeah,
I think so. It's happened to me a few times in my life. And I always go back and pick them up again later. Oil painting was something that I would do almost daily in my 20s. And I went back to it a couple of years ago. And I mean, it was great sort of to get the feedback from the universe. I got a piece put in an art prize, and I almost won it, but not quite there. But that's the kind of thing that, you pick up, you put down, and it doesn't take too long to get back on the bike, I suppose, to pick it all back up again. But, Brazilian Jiu-Jitsu is the same for me as well. Like, I kind of really fell out of love with it. And I remember having a conversation in a car park with a friend who was just like, I think your decision's made. You're not enjoying this anymore. And he was right. Shout out to Dan. He was right. But now, like, the hunger's coming back a little bit, the need to, go and do that stuff. I feel myself getting weak.
So how that's interesting. I didn't know that you fell out of love with jiu-jitsu and then came back into it. How long for?
Well, It's been about 1.5 years now.
Really?
Yeah, but the out of love bit was probably sort of a year of that as well. I just kept turning up, and it's called the Blue Belt Plateau. And anyone who sort of gets to a level of a blue belt in jiu-jitsu can do reasonably well against everybody. But those people that push through the plateau and keep going, and that's what everyone keeps telling me to do, get through to the other side and get their purple belt, I guess. But I couldn't do it. It was sapping me on many different levels.
So I'm assuming what you're saying is that there's like a quite a exponential skill curve increase on that belt, is there?
There's a huge skill increase.
Huge, even bigger.
Huge on the white belt before you get the blue. And once you get the blue, you feel like a god king. and then you carry on going, and you feel like for me anyway, there was a certain sort of fuse that was lit, and I was just, running off that fuse. And then I sort of began to lose passion. I began to stop turning up for training so much. And whenever I was training, I wasn't sensing myself getting any better. And then, in those moments where you sort of question yourself, when you question your moods and you question what you're getting out of this thing, the answer just kept becoming more and more starkly, you're not really getting much out of it anymore. And that was the truth. That was a real sad truth. And I spoke to people about it. I spoke to my teacher. I spoke to the other students who were promoted at the same time as me and who were promoted after me as well. So higher belts. And they just kept saying, keep turning up, keep turning up, keep turning up. And if you've ever done anything like it, it's incredibly physically demanding. So it was beginning to have an effect on my mood, which was one thing. But, previously I would have been able to cope with the sense of tiredness, achiness, and, everything that comes with training hard at anything the next day. But when it began to interfere with work, and then I set up a business as well, and it began to interfere with my performance in my business life as well. It just started to really, unfortunately, become an inevitability that it had to go. But I'm starting to feel like it could come back in one way or another now. Part of the problem was I was training late at night.
You're trying to fit it in.
Yeah. I was training late at night. I was full of adrenaline. I was coming home and I just wasn't getting any sleep. And I was going to work the next day with like 3-4 hours sleep. And that became real habitual.
Yeah, that's not even healthy, Chris, really.
No. I'd be driving home from training and thinking, I'm not going to sleep tonight.
Yeah.
And, how do you talk yourself out of that? And I tried everything. And some of it worked for a while, and then some of it didn't. And it just became really, really tough.
Well, your adrenaline still have been pumping as well, because you've obviously, it's like a contact sport. So,
yeah.
And then you're trying to go to sleep straight after.
Yeah, still sweating.
Yeah.
In the summer, it was brutal with the heat. And jiu-jitsu's in a thick gi because, the thin karate ones get ripped. So you're like wearing a winter overcoat in the middle of August.
Oh my God.
Training 2 hours.
Wow.
Straight. It was a lot of fun. And the fun parts are what I remember and want to go back to, I think. And there's a dojo that's closer to my house as well. I could even walk here and walk back so that, I could come down properly on the way home, I suppose.
Yeah.
But, you don't want to train on a full stomach. So I was eating when I got back. I put on loads of weight because I was eating my meals when I got home at like 10:30.
Yeah, in the middle of the night.
Yeah. I wasn't intending to go here.
It's quite, it's a good journey because you're describing what happened.
Yeah, I did enjoy it, and I found everyone was like leveling up, but I was staying the same. So everyone was really like wise.
Which can be difficult. That can be difficult, right? It's hard.
Everyone was, much wiser than me. Everyone was learning new things, and I just wasn't. And do you know what? If my teacher's listening to this, I know exactly what he would say. that I didn't turn up for training enough. But life began to get in the way and something had to go. And it ended up being that, you know?
It can be like that with anything. I mean, it could even be like that sometimes with this podcast. And there's going to be situations where you have to like, obviously I think we're going to keep obviously pushing through with it because we enjoy it and it's good and it doesn't take much out of our time. But obviously you're going to go through situations with anything if you do it enough where there's going to be periods where you're unsure and you've got to you either push through or you don't, right? And I guess that's the only comparison I could bring to it myself. I mean, there's music with me, which was, if I'm going to share a bit of my side, was like, I kind of fell out of love with music production at one point because I'd done it for years and I wasn't really getting anywhere with it. I enjoy it. I enjoyed it, but then you start weighing it up in your head of like, well, I'm putting all this resource into it and I still haven't actually made a song. I mean, I've made songs, but I've never released them. And then, you know, how much longer do you keep going with that? And then I did take a long time out, and I don't know. It's weird with things like that, isn't it? Because you kind of get an itch that you want to go back. Because that's what I've been getting recently as well. Is like I want to start making music again. But
have you? That's
cool. And I don't know. It's an interesting one because like when you talk about how do you get your passion back, I guess in that aspect, sometimes it just comes back on its own after time away.
Yeah. When I talk to people about jiu-jitsu, I tell them the truth, which is not a day goes by where I don't think about it. Going back or what I learned or the people that I met, all of that stuff, you know? Because that was one great thing about jiu-jitsu, actually, I would say, is it increased my social circle massively from like day one. I had all these new people that were calling me brother, you know, and I felt like I was part of something and it was great. And one thing about jiu-jitsu people is that they're obsessive. Perfection, performance, all of that, they're obsessive about it for the most part. I think, you know, once you get really, really senior, you've been doing it for like 10 years, it just becomes part of your life. But it is squarely in a lot of people's focus for like the longest time when they first start. I mean, I talked to this friend I met called Vargas, and he's a vegan endurance athlete. And I keep telling him, social media, like smash it up. He's doing great stuff on Instagram, by the way, and he's called Vegan Machine on Instagram. So do check him out. But he's got some great videos of him doing his endurance athletics. And I'm like, do a YouTube channel because people are going to love this stuff.
Yeah, they will. They will. It's also very current at the moment.
Yes, absolutely. He lives in a van, and he converted the van from like a work van, you know, workman's van into something that he can sleep and live in when he's driving around like the Cairngorm Mountains and stuff like that, and then running.
Jesus.
I'm like, YouTube channel? He's like, jiu-jitsu's priority, mate. And I'm just like, okay, I understand. I do understand. I don't agree, but I understand. Yeah. Yeah. So, I mean, I guess it's the same with music, right? It's like something that you've stepped back from, but now the itch is coming through. I haven't heard any of your music. I would like to one day when you're ready to share.
Yeah. Eventually. I mean,
yeah, eventually.
I think what you said is like, I think if we're gonna go back to what do you do if you lose your passion, I think this is if you can actually do this, right? Because I think it's more complicated if you're doing it as a job. But if you're just doing it, if your passion's a hobby, then you're not beholden to it. So you can take a step back and let that naturally come back. Because if you're really passionate about something, then I guess it will come back, won't it? It's not just going to fizzle out.
No, I think you're right. And the more you can establish a routine, perhaps when it comes to something like creativity. So it's something that you're always going back to the well of creativity on a regular basis. So it might not necessarily be working all day on a song on a Saturday when you haven't got your day job on. But it could be, researching, different beat patterns, or, going back to that well on a regular basis to make it a habit, to help formalize it. I mean, I'm trying to think of the other people in my life who've got passions. Like my wife's passions is restaurants and food, but that's a real, that one is really easy to maintain because you never really feel unmotivated to eat. I mean, it goes on so long until you have to. It's it's not something that you really can fall out of love with, I suppose, is eating. So I would say a daily appointment with yourself to be creative. Austin Kleon writes about this a lot, like the war of art and show your work. He's got another book as well. I can't remember the name of it, but they're both really good. And he's even got a, not a planner, but a journal, how to be creative, do something creative every day journal. And it will get you started, of course. And it's Steal Like an Artist. That's it. Steal Like an Artist. And the Steal Like an Artist journal by Austin Kleon. He does some great stuff, which, I mean, any artist or creative people who want to endeavor to do something and find themselves struggling with procrastination, that's a way, that's a real way that's going to be able to help you get along with, whatever creative endeavor you want it to do, whether it's music or art or jiu-jitsu, whatever it is.
Or podcasting.
Which
is amazing, which is an amazing creative avenue, just saying.
I'm really glad you feel that.
Yeah.
I'm really glad you feel that. And you have done that with this as well. You've really let
I wouldn't want you to misconstrue when I mentioned that earlier as something saying, eventually it's, we're not going to become passionate about it and it'll die out. But what I'm trying to say is that this stuff happens, and it happens to a lot of people. And sometimes if you think you've got something good, you do have to kind of push yourself to persevere with it now and again, because if you're doing even if you're really passionate about something and you do it repetitively all the time, there are going to be periods in that time frame where sometimes, you're not really feeling up to it. So you kind of force yourself to do it maybe that day, and that's normal, that's human. And that can sometimes affect your passion on stuff when you're kind of pushing yourself to do something maybe. But if you're trying to keep to a regular schedule of doing something, for example, like a podcast, then you kind of have to push through that anyway.
I don't think I misconstrued what you said at all. I've been around long enough, I think, to realize and understand the fact that it's all new. It's a shiny new toy initially, but eventually that shiny new toy will dull, and we just got to you're right. You must keep going. And what's great is, I probably would have given up on this a long time ago if it wasn't for the fact that we can bounce the whole thing off each other and rely on one another for motivation. And when I'm dipping, you're up, and when you're dipping, I'm up, and hopefully somewhere in the middle, we keep it rolling.
Yeah, I agree. I guess we've got a bit of time left, so I'm going to quickly go back to one thing, which would be, and we touched on it briefly about jobs. So we were talking about jobs earlier, and we talked about what happens if you lose your passion in something, say, a hobby. That's different to losing your passion to something that you do as a career, because I think, like I said, you're sort of beholden to it in a way. And I just wondered what your reflection would be on that point, because I think it's more difficult to get passion back on something when, as I said, it's a repetitive task. And I mean, when you're doing it as a job, it's even more repetitive because you're literally doing it Monday to Friday, usually 9 to 5:30.
Yeah, I do have some reflections on this because even though I'm incredibly privileged to do a job where I'm helping people, and I generally almost every day finish the day feeling like I've helped someone, even if it's some small way of just communicating with them, about the results of a test or something like that, I always feel like I've been able to help people. And when I'm not in that headspace, when it becomes mundane or boring or difficult, hard, all of the negative stuff, what I try and do is remove the emotion from it and instead completely focus on thinking about leaving in the evening, leaving your work in the evening better than the way you found it in the morning. Are you with me?
Mm-hmm.
Small steps make good progress over longer periods of time.
Yeah, no, I mean, I don't really have anything to add to that. I think that's a good way to sum it up. Yeah.
Thank you.
Yeah, baby steps.
Yeah.
I suppose I'm trying to think of a counterpoint, but I suppose the only thing that I could say to that is that's probably easier said than done for someone who really, really has completely lost their passion, right? Because if you're down in that hole, it's probably a lot harder to have that mindset and that frame of mind.
Yeah, if it's work stuff and work can be mundane. There's really, but taking those small baby steps, as you say, to get through to the end of the day and make sure something's been chipped away at, so that it's a little better than it was in the morning when you leave it in the afternoon or the evening.
Okay. I mean, I think that summarizes it then. If you're in work and you've lost your passion, small steps. And what was that phrase again, Chris, that you said?
Remove the emotion and think about how you can leave things better in the evening than they were when you found them.
I'm just trying to compartmentalize that statement.
Yeah, worry less about getting things done, I suppose. Think less about, this is really about procrastination, I suppose. And it's less about what's worth you and what's worth your time, and a lot more to do with getting the tasks done that are required, I suppose. Yeah.
But it should be the tasks that you enjoy. It should be the tasks that are your passion.
Yeah, if you can. But work is not passionate for a lot of people. Work is incredibly mundane. Take yourself back 5 years. For example, work's incredibly mundane for a lot of people, and we've got to get through. So how do we do that when it's difficult? I've been there. And I always found the negative emotions surrounding it were the least helpful part. And so that's why I try and, bring an element of mind that's devoid of emotion to the circumstance initially, at least. And then, you can feel like you've done a good job at the end of the day if you've made some progress.
Yeah. I think you could easily go off on another tangent there altogether, really, about how, I mean, when you talked about the mundane stuff, you could basically say that the baby steps is, I mean, not everybody gets to do their passion straight away. So for some people, it's a series of stepping stones to get to their passion anyway. And you have to think about that and try and pull bits of your passion out of whatever job you're in, however small they are, and realize that it's a journey, I would probably say as well.
I don't know if passion is entirely the driving force for work.
Yeah.
Either. I've had a circumstance where I created a business around a passion. I've tried to do that in the past because this is the advice you always get when you're young. Follow your passion.
Yeah.
So I did. And it made me fall out of passion with the passion.
And that's a risk. That's a risk that you take when you do a passion as a job.
Yeah, it was a gamble. It was a real roll of the dice circumstance, I suppose. I mean, not in any material sense, but when it came to the emotion side of things, yeah, it did. So I'm not convinced, but I think what your passion, I'm not convinced that passion is a requirement for doing good work, but I think what you can bring to the table, what does arise from passion, are the skills that you learn. Like if we go back 20 years, more, 25 years. I wouldn't say that my passion then necessarily equates to my passion now. My passion back then was WWF. I wanted to like somehow work for Vince McMahon. But the passion that drives you to go and do things in the world means that you end up, I mean, I've been through so many different phases like that. You end up with a range of skill sets when you do follow those passions, when you do try and actually follow that advice, follow your passion, and you make something of your own. I created a product, I marketed it, I brought it to the market, and I tried to get it out there, and I tried to make it something. All of that was not wasted time. None of that was wasted time. It failed. But I won lots of new skills and confidence that I bring with me everywhere I go, in everything that I do. I don't know if that's worthy of inclusion. I'm not sure, like the Vince McMahon bit.
No, that's a great message. I mean, that I think we can just leave it there as far as I'm concerned, because you've the way you left it is, I mean, you've also said that basically that it's okay to fail, which it is.
It is okay to fail. It really is okay to fail, because you have set yourself apart from 99% of the people that never even tried.
And that is a standout quote that I've heard many times, but I still love it. Because it's better to have tried than failed than never tried at all.
Yes.
Yeah.
Yes.
Yeah. So I think that's it. I mean, we kind of went on an exploration at the end, but I think that was a really nice, interesting episode of In Clinic, with a few personal stories, which we don't always do, but it was nice. It was nice. It was a good one. And I still stand by what I said, that, you know, if you're kind of losing your passion on something, if it's a hobby, if you're losing your passion on something and you have the time, the opportunity, and the no burdens to it, take the time away and it should come back. Obviously, if you're doing it as a career or it's something that you do regularly, it's a bit more difficult and you're kind of burdened to it. That's more tricky, but the best thing, time is the healer. And I think Chris would agree with that.
Yeah, time really is a healer. Absolutely.
So on that note, I think we're going to wrap up there for this episode of the Mind Games podcast. And we'd like to thank you all for listening and or watching if you tune in on YouTube. We obviously like doing this a lot, so we would really appreciate if you could like and or subscribe. We are on Instagram, we are on Twitter, we are on LinkedIn. And please send any questions you have to our email, askmindgamesuk@gmail.com. That is askmindgamesuk@gmail.com. You can also direct messages. I'm not going to say DMs this time. So there's Instagram, there's Twitter. You can even direct messages on LinkedIn. So you could do that. And any questions that you have, just relating to anything that's on your mind, please send them our way. We want questions, people. Send us lots of questions.
Yes. We want likes, we want subscribes, and we want shares and all those things. But the stuff that makes us really happy, it really tickles the pickle, are the questions.
Yeah.
So do ask us questions, because it feeds the show and it makes you part of a community of people that are joining us as well. They're always anonymous. We're never going to read out and say, hey, it was Billy Bobby that was asking this question. It doesn't work that way. It's your anonymity is always guaranteed, from at least from my point of view. I think you agree with me, don't you?
Yeah, we'll never reveal names of anyone.
Yeah, and we'll even change some details if it's necessary. So do let us know. Do ask us questions, because it really makes you guys part of our show as well.
And it makes us happy, because we feel like we're helping someone if we get a question that's really deep and we can answer it, and hopefully, even if that one person goes away and takes something from it, then I think that's our job done. Yeah. Even
if we talk for 12 minutes, but only 2 of those minutes are relevant for you, and it's been time well spent for you, hasn't it?
Yeah, absolutely. So once again, I'd like to thank Chris for joining us on this episode. As always, the Master of Positivity. And from myself, the Chronic Health Warrior, we will see you again on the next one.
Bye-bye.